Good morning. I am Dr. Goel. I am Director of Department of Surgical Gastroenterology, Minimal Access and Bariatric Surgery at BLK Hospital. As all of you know, BLK is an internationally recognized multi-speciality hospital in heart of Delhi. All of us know that. We are celebrating 26th November as Anti-World Obesity Day, and on this occasion today we are going to talk about obesity, magnitude, lifestyle problems, bariatric surgery, healthy eating and problems of obesity. Dear friends, as all of us know that obesity is a curse on society. Government has declared war on obesity and government recognizes obesity as a disease which not only comes with lot of baggages but has direct side effects on the health. Diabetes, hypertension, cholesterol, infertility and certain types of cancers are now recognized as problems related to obesity, directly or indirectly. Most of the people who are overweight or obese are likely to have these diseases which I have just enumerated in more proportion than normal people. Why does obesity happen? Let us look at that. It is a very complex mechanism which has various pathways like genetics. Sometimes obesity runs in the families, unhealthy genes, our lifestyle where lack of exercise, unhealthy eating, stress, all this leads to increase in weight. Then hormones. A lot of hormones in our body play havoc and cause obesity, especially in women. As you know, women of different ages will have different hormones playing in their body. Most of these hormones leads to water retention and fat deposition. Hence, women are more at risk of obesity because of hormones at different stages of life. WHO says that millions of people die every year throughout the world, irrespective of developing nations, deprived nations or developed world because of obesity. Obesity is a kind of malnutrition. Malnutrition doesn't necessarily mean lack of nutrition. It means not right. Even if you overeat or if you overconsume some portions of your nutrition like carbohydrates and fat, this is also called malnutrition. Millions of people in India are suffering from obesity and they are likely to suffer from obesity in times to come. According to one survey, around 30% of our population is obese or overweight at this point of time. By 2025, we are likely to be the world capital of obesity and diabetes. This is a matter of shame. We would like to definitely be number one in so many other ways in the world, but not definitely when it comes to disease index. Very frequently asked question is how to tackle obesity, how to reduce weight. Well, all of us know that the best method is natural method, and natural method is what? Is leading a healthy lifestyle which includes physical activity on regular basis, eating healthy. Mind you, we never recommend to diet, we never recommend for you to remain hungry or to fast. What we mean is that one must eat healthy at most of the times. If you eat healthy and if you regularly exercise, I think controlling your weight is not a major problem. For people who have morbid obesity, people who are overweight, people who have lot of diseases which are related to obesity like diabetes, like obstructive sleep apnea, like hypertension, like hypercholesterolemia, like infertility, like cancers. These are the people who may require help in terms of intervention. When I say intervention, what I mean is bariatric surgery. A lot of you may not know what is bariatric surgery. Bariatric surgery is a field where we do surgery for people who are morbidly obese. I am using this word morbidly obese quite frequently. Let me also for a second let you know how do we calculate obesity. Obesity is calculated by a simple formula called body mass index. How do we calculate BMI, body mass index? Weight in kilogram divided by height in meter square will give you your BMI. Normal BMI is between 18 to 24. Let me give you an example. Suppose somebody's weight is 100 kilograms, and if you divide it by height in meter square, say height is 2 meters. So, what you are going to receive is your BMI, which is going to be around 38. So, normal BMI, as I said, is up to 24. For Indian population, Asian population, if your BMI is more than 35 and you have comorbidities, you are a candidate for bariatric surgery. And if your BMI is 37.5 and you have no illnesses, you are a candidate for bariatric surgery. Now, let us look at what is bariatric surgery and what are the types of bariatric surgery. Bariatric surgeries is a surgical field where we do surgeries to control weight by altering the size of the stomach and also by sometimes altering the pathway of the food which it takes. There are two kinds of bariatric surgery. Number one is called restrictive bariatric surgery and the other one is called restrictive plus malabsorptive bariatric surgery. When we talk about restrictive bariatric surgery, it means that either we are going to put a gastric band around your stomach to reduce the capacity of the stomach, so one can eat less and gradually lose weight, or we can do laparoscopic sleeve gastrectomy, a very popular procedure in the recent times. What we do in sleeve gastrectomy, we create a tube out of the stomach by firing staplers, and this tube is very thin, it cannot expand, and the eating capacity of a person reduces to bare minimum and one starts losing weight. These two are example of restrictive bariatric procedures. Let us look at the procedure which is called Roux-en-Y gastric bypass. This is a very old procedure and it is considered to be a standard of care today in terms of bariatric surgery. Roux-en-Y gastric bypass, where we create a small pouch of the stomach of roughly 40 to 50 milliliter capacity and we join it with the small intestine. So, whatever we eat, one is stored in the stomach, which is the small pouch, and second, it directly bypasses the stomach to a small intestine. So, there is some amount of malabsorption, which these two methods lead to weight loss. What is interesting is that apart from weight loss, the diseases which are associated with obesity like diabetes, like hypertension, like hypercholesterol, like infertility, OSA, that is obstructive sleep apnea, or in layman terms is snoring. You see a lot of people who snore while sleeping or they get up while sleeping because they feel that they are feeling suffocated. This is an obstructive sleep apnea. All these diseases get resolved up to the tune of 95% after bariatric surgery. Even if before you lose significant weight, your diabetes comes under control, your sleep apnea or snoring comes under control. This is very heartening and very scientific, but this is something which is also a benefit of bariatric surgery. So, let us not look at the bariatric surgery only a way of reducing weight, it is also a way to make you healthier than what you are today. Hence, bariatric surgery becomes very important tool for us to treat people with overweight and to treat people who have other diseases which we have just discussed along with overweight. Another very important question which is asked to us is that what are the complications of bariatric surgery? Well, let me be very frank, no procedure in this world is complication free. Similarly, whenever you do any procedure in the body, you can have bleeding which can be controlled, you can have leakage which can obviously be controlled, you can have clotting of the veins which is called deep vein thrombosis. All these complications are there, but the percentage of these complications is negligible, it is 2 to 5%. most of the time the benefit of the surgery outweighs the complication chances. Most of the time the problems of the diseases, problems of the weight is so much that these complications or these potential complications, they look negligible. Another myth about bariatric surgery which is prevalent in society is that after bariatric surgery, since you are not able to eat much amount, you will feel weak or you will have nutritional deficiencies. Well, I would say that if I talk about feeling weak, it is completely unfounded. In fact, by losing weight, by eating less, you feel much more energetic than what you feel today. You are able to do things which you are not able to do today with so much of weight. Just to give you an example, most of our patients would be able to climb stairs within a month of surgery if they are not able to climb stairs today, and most of the people would say that if they climb stairs today, they feel breathless or their knees hurt, and most of the patients after bariatric surgery do not complain of these qualities, and they are able to walk, in fact, for longer period of time. Most of our patients are able to walk between 5 to 6 kilometers within a month, which you have never even dreamt of that you can do. So in nutshell, after bariatric surgery, your physical ability to do things increases tremendously. On the contrary, though the myth is that you will feel weak, which is not unfounded, which is not true. Coming to the vitamin deficiencies or nutritional deficiencies, well, the kind of food, as I was saying, we eat today, we call ourselves malnourished. If a normal individual today do your test of vitamin